Just in case there are people like me who had very limited knowledge of nursing and healthcare, I'll explain every single thing. Clinicals, or practicums, is where nursing students spend a month or two at a given hospital or facility. For example, you will get the chance to work under supervision in places like medicine nursing units at hospitals, or a psych unit, or a labor and delivery unit. Sometimes you even get to go to an elementary school to work with kids, and sometimes you go to a homeless shelter or a seniors lodge to help out. I'm going to focus on clinicals in hospital settings. And I will tell you right off the bat, I struggled hard. Why did I struggle? It's because of time management. And what was so hard about time management? Every nursing skill you learn from school, you learn how to do them exactly by the textbook standard, following letter by letter, step by step of the gold standard. Now, I'm not saying this is not important, but you will find out very quickly how time-consuming it is to do everything perfectly. There will be that first day when you get your first patient and you get to spend the whole 8 hours of your shift on that one patient. Every nursing skill you do, whether that is head-to-toe assessment or preparing medications, for me, this took sometimes hours to complete. Why? Because you are taught the gold standard in school, and you're trying to meet that standard for every single thing you do. I will always have a grudge to all my nursing instructors I've ever had because of this. Because they know how different real-life nursing is in contrast to what we learn from nursing school. And they don't share that at all. Let me give you a very specific example. The gold standard of preparing and giving medication. I was taught to check what is called the 7 rights of medication. We check that it is the right patient, right time, right dose, right medication, etc., etc. Sure, they are very important, but do you know what I was asked to do? Check these 7 rights 3 times over for every single medication, so that I can be sure that I'm not making any mistakes. Absolute bullshit. And there I was, in the medication room, spending tens of minutes, checking everything 3 times, trying to figure out why I am so slow. And I thought everyone did this. Another example. Sometimes patients are too weak to get up out of bed. Nursing is to provide a bed bath. So again, there I was, trying to clean my patients as thoroughly as I would clean myself. Rinsing their body first, then applying soap, and then rinsing that for every square inch of their body. By the time the patient is dry with new patient gown put on, a good 20 to 30 minutes have gone by. I just needed someone to tell me that's not how you do this. I just needed someone to tell me that real life nursing is different. You do not go over and beyond, because if you do, you will get no breaks, you will always be behind, and you will burn out immediately. When you get your nursing license and you get hired as an actual nurse, providing textbook gold standard care for all 4 to 5 of your assigned patients is impossible. I failed one of the 3rd-year nursing clinicals. I had to take this course again. And after I failed, I understood why I failed. And then things were much, much easier. So I wanted to share some of the realities of real nursing so people don't suffer like I did. In your practicums, of course, there will be days when there are lots of empty patient beds, meaning you only get assigned 1 or 2 patients in a given clinical shift. Sure, in those days, feel free to go above and beyond for patient care. And of course, when your teacher is watching you do an assessment on a patient, do everything textbook standard like you learned in school. But when you have your full assignment load, which is 2 to 3 patients, depending on different hospital settings or depending on how well you're doing, this might sound bad, but you have to skip most of the tedious steps you were taught in school. Washing patients, it's basically soapy water applied right from the get-go to maybe 75-80% of the patient's body, and wiping that up with a towel. Forget washing the hair, unless the patient has not much hair to begin with, or if it is extremely dirty. Your head-to-toe assessments. One of the things you will learn are some bullshit things we never do, such as skin turgor and tactile percussion. What the hell is this? Skip them. No, it feels wrong? Go up to any nurse and ask them when the last time they percussed in between the ribs. What do you think their answer is going to be? And listening to lungs? Do you know what the gold standard when assessing lungs? Every 2 intercostal space, you are asking the patient to do a deep breath. Every 2 intercostal spaces that you are placing your stethoscope and listening to, front and back, left and right. Do a deep breath with me. Inhale and exhale. How long did that take? 4 to 5 seconds. And how many times do we have to get the patient to breathe? 20 times? That's 1 minute and 40 seconds, maybe more, for only lungs. And we're asked not to spend more than 5 minutes for the full head to toe? Yeah, good luck with that. In the real world, it looks more like this. Upper chest, front and back. Lower chest, front and back. Now, what I'm trying to say, I'm not telling you to skip things to the point where the patient's health might be compromised. I'm telling you that there is a smart way to go about things. Don't do a full-on, in-depth, long assessment on an 18-year-old who came in because of an ankle fracture. There is always a way to omit many unnecessary tasks or assessments and still provide 95% of the expected patient care. Now, to decide which assessments and tasks to omit, this you will learn with trial and error. And in my case, I learned this by crashing and burning. I have only figured it out on my very last clinical in my 4th year of nursing school. Only other major advice I can give is for you to be busy, at least look busy. Answer call bells. That is the number 1 complaint from my coworkers towards nursing students. They say, nursing students these days seem to just linger in the hallways not doing anything. Oh, if that were me back in the day, my instructor would have torn me a new asshole. There's always something you can be doing, whether that is emptying garbage in patient rooms, doing blood pressure in patients, checking blood sugar, talking to patients, or mobilizing patients. You need to almost break your back doing this for the first week, especially those precious first 2 to 3 days in clinical, where you will have no patients to look after. Your only task is to follow around a nurse and watch what they do. And trust me, if you give it your full effort, a nurse will absolutely notice this and praise you and tell the instructor about you. Start your clinical with a favorable outlook. And always ask to see something new and interesting. Always ask your primary nurse what she's up to. If she was just about to go on break, ask if any chance you can do any of the leftover tasks in her stead. If you're not allowed, the least you can do is watch and ask questions. You have no idea how much our nurses welcome students who are eager to learn and help. And try your best not to ask the same question twice. Write it down and memorize what the nurses tell you. Lastly, one more very important tip I want to tell you is to find whatever excuse to go and mix words with any staff, whether that is your buddy nurse you're working with, the charge nurse, or even the doctor. Now, I'm not talking about friendly talk or how's it going type of talk. Ask them questions about a patient status and at the same time mix in your opinion of what you think we should do. I'll give an example of what I loved hearing from a student nurse. And before I tell you the story, I'll just say that in my hospital, our blood sugars are measured with millimole per liter, with acceptable glucose range from 4 to 10. A student nurse that I've never seen before comes up to me and asks this. Hi, my name is whatever. My patient in room 2 has a blood sugar of 12 right now before supper. He is also nauseous and says he won't eat any supper. Do you think I can hold the insulin and check his sugar in a little while again, instead of giving the scheduled insulin? And I smiled and said, very good, let's do that. My name is AHN, and nice to meet you, whatever. I advise you to rarely say, what should I do, as a question. Always think of something you think we should do and turn that as a question as if you were seeking verification. Those were my advices in a nutshell. Good luck.